So you guys, so for the agenda today, we are going to brief you on the purpose of the training, as well as sort of summarize your desired takeaways from the training, as well as a guide to accessing mainstream services to provide you a summary of what that entails. And we're going to have the departments provide program information on mainstream services. We are going to be seeking your feedback on the utility of the guide. And then we're going to actually apply the guide by looking at some real life scenarios. And we have some presenters from your fellow interim housing operators. And then we're going to discuss future collaboration before we break. We do want to let you know that we are recording these meetings because a lot of our partners are unable to join. So we want to make sure that they have something to look at, even though they weren't here with us today. Let's go to the next slide. So the purpose of the training, as I shared, is to learn about the county mainstream services. And we really want to make accessing and navigating mainstream services an easier task because we understand that you guys are spread thin and you guys are putting out fires along the front lines. We also want to co-develop recommendations to strengthen our interagency coordination to improve client outcomes. And definitely, as a team, we want to identify future partnership opportunities together. Next slide. So you might be wondering, so who's here with me today? For today, as being the third session, it's a pretty small group, but we have interim housing operators from all SPAs, as well as from all populations, including adults, children, families, and domestic violence and others. And we have our traditional case managers, housing stabilizers, intake coordinators, as well as mental health clinicians. We have medical staff, including hospital liaison, LVN, RNs, medical assistant, and we also have directors, managers, and supervisors on housing navigation programs, as well as administrative services and quality assurance. We have grants coordinators, job developers, and a lot more. And that really shows the diversity of all of the amazing partners who really work along the front lines, either supporting the clients directly or management who support those that serve clients directly. We also have 5 county mainstream departments who are here with us today, including Department of Health Services, DHS, Department of Mental Health, DMH, Department of Public Health Substance Abuse Prevention and Control, DPH-SAPC, Department of Public Social Services, DPSS, and last but not the least, Department of Children and Family Services, DCFS. We also have our interim housing funders, including LASA and DHS, DMH, DPH, SAPC, because they actually fund interim housing. And of course, we have the County Chief Executive Office Homeless Initiative. So welcome everyone. Next slide, please. We've also included a survey when you RSVP asking what your desired takeaways are. What many of you guys have shared is you guys want to learn more about the mainstream benefits and services because there's never enough information that you guys could use because the scenarios are so diverse. No client presents the same situation. And also you guys want to be able to better access interim bridge housing, sober living centers. Many of you guys requested this, training on de-escalation, harm reduction, conflict resolution, and mental health services, and as well as access to higher level of care needs, like full service partnership connections. You guys also want to find out how to expedite paperwork to speed up housing placement, and how you could obtain documentation for difficult to serve clients, including the undocumented. And then you guys wanted more information on housing resources and navigation, and also for clients who are resistant to services, how you could engage them to be open to services, as well as problem solving, employment services, domestic abuse, as well as accessing services through community partners. Because we know that mainstream services, the system is not the one and only solution, but it really is the marriage between what's based in the community as well as what's in the county system, and to really amplify our efforts together. Some of the directors and supervisors wanted to know what their roles and responsibilities should be to really be able to enforce accessing mainstream services and how they could better support frontline workers, networking, and also last but not the least, anything and everything that will benefit your clients. So I think we're not going to be able to cover everything today, but we do hope that as a result of this training, we are going to have more opportunities to be able to get together and really take a look at what the training needs are and how we could co-create it together to make sure that it really best meets everyone's needs. Next slide. So I'm going to share just brief sections on the Guide to Accessing Mainstream Services. Next slide. This was released 3 weeks ago, and your funders should have shared that with all the management that should have been shared with the frontline workers. If you had a chance to flip through it, it serves as a resource for all interim housing operators to access and navigate mainstream services. We want to make sure that all key information was at your fingertips, so that again, to make it an easier choice. We wanted to increase, as a result, ultimately, interim housing clients' access to mainstream services. We want to increase awareness of our operators' knowledge on mainstream benefits available to our clients, understand the basic requirements of benefit, eligibility requirements, application process, and documentations that are needed, and also where to go, where you need additional information or where you have questions or where you need to de-escalate. It serves as a living document that will continually be updated, incorporating your needs and your suggestions. So this is going to be really important because we want to make sure that we include all the information that was requested, but then it may need to be modified because there's ongoing quality improvement. Next slide. There are some key sections in the guide that I will briefly go over with you. And I just realized, you guys, I did not introduce myself. I apologize. My name is Ashley O. I'm with the CEO Homeless Initiative. And we work with all the operators throughout the county, as well as our interim housing funders. And of course, we are the steward of Measure Age, which provides the lion's share of the vital services, including interim housing. So that's who I am. And I'm also joined by Natalie Pacheco, who has been instrumental in providing logistical support. So thank you, Natalie. So that was a little late.
Ashley, you're on mute. Ashley, I think you're muted.
As well as department contact information to troubleshoot. You're going to have a side-by-side mainstream core programs. It's a cheat sheet because sometimes it's going to be easier to have one document where you could like zero in to get the information you need. We included all the program flyers that's highlighted here, as which could be utilized for staff or our clients, referral forms, training resources, which is going to continue to be built out, as well as, again, department and program contact information. So we really do encourage you to flip through it and also provide us feedback. Next slide. This is a cheat sheet that we created. You're going to see a lot of hyperlinks so that, again, we want everything to be at your fingertips. And we have the 4 mainstream departments, program information and contact info in that document. Next slide. And then we also have the program flyers. So this is like really colorful, user-friendly flyers, which includes program information and contact info. It could be posted in your offices. It could be used as staff training. It could also be distributed to the clients who might benefit from this service. Next slide. Mina, I saw your comment. Yes, we are going to be sharing the guide as well as the copies of the presentation. Absolutely. The next slide is the referrals to mainstream services. And again, this is just a sample of what we included. Next slide. And then we also included contact information of various programs and departments. Starting with the upper left-hand corner, you're going to see contact information to mental health, full service partnerships, some contact information for adults, and then that's right, children. On the left right, you're going to have can we go back to that slide? We are looking at the title page now. Thank you. And then on the lower right left, you're going to see contact information to DMH's crisis call lines. In the middle, you have the domestic violence provider's contact info. And then further to the right, you have the chief's information to the DMH's service areas, spa areas. And then on the lower right-hand corner, you have a sample of the department contact information, including when you need to troubleshoot and escalate. Next slide. So now it's my pleasure to do a warm handoff to our county departments, who's going to briefly provide their program description. We are also going to provide time after each department's presentation to ask questions. What would be really helpful as you could think of questions, please text them here. And also, if we have time, we're going to ask you to verbally raise them as well. We are going to be putting together a Q&A guide incorporating all the questions that were raised, and we're going to provide responses to them. So this training is only as good as everyone who contributes. So again, text in your questions and ask your questions. I'm going to now hand it over to Stephen Yu. Stephen or Lydia, if you'd like to introduce yourself and your team, and then if you could present to our partners, that'll be greatly appreciated. Thank you.
Good morning, everyone. My name is Stephen Yu with CBEST. I'm a staff analyst with the outreach.
You might be on mute.
Could you hear me?
Yeah, we can't hear you. Oh, maybe others could hear you. Maybe it's just me.
Yes. We can hear you, Stephen.
Oh, okay, great.
Go ahead. I'll troubleshoot.
Hello, everyone. I'm Steve with the Countywide Benefits Entitlement Services team. I am a staff analyst with the Outreach and Referral team. Our senior analyst, Lydia Melchor, is not here with us, but she oversees the entire OAR team. Next slide, please. Today's agenda, I'll briefly go over CBEST, cover the 3 disability benefits that we primarily work with, the CBEST structure, steps, and timeline, as well as our referral process and point of contact. And then I'll highlight the value of mainstream services as well as one success story. So CBEST is an acronym for the Countywide Benefits Entitlement Services team. We have a team of people from the Department of Health Services, as well as benefit advocates, clinicians, legal partners that all work to help individuals apply for SSI, SSDI, CAPI, early full retirement, VA benefits, survivors benefits, and we also provide services for appeals for cases that may have been denied. So the 3 main benefits that we work with is the supplemental security income, the Social Security disability insurance, both of which are administered by the Social Security Administration Office, and the cash assistance program for immigrants, which is funded by the state of California. The main thing to know for SSI is the 3 main criteria to know for this is, number 1, they need to be low income, meaning they need to have less than $2,000 in assets. Number 2, have a disability that prevents them from working 12 consecutive months. And number 3, be either a qualified immigrant or a U.S. citizen. For Social Security disability insurance, it's number 1, they need to have some sort of disability that prevents them from working, as well as work history in the past 10 years. SSA, what they'll look at is how much they've contributed towards FICA taxes during the last 10 years and make their determination on the benefit amount. And lastly, they also look at whether the applicant is a qualified citizen or immigrant and a U.S. citizen. And the cash assistance program for immigrants, the eligibility criteria for this is exactly the same as SSI. And the reason why the state of California has this is because in 1996, the Welfare Reform Act prevented immigrants who came into the United States after 96 from being able to access federal benefits. And so the state of California created the SSI equivalent just for California residents. The SSA eligibility assessment process is two-pronged. SSA will look at the non-medical eligibility. They'll look at income and assets. As I mentioned before, for SSI, it's a means-tested safety net program, so they need to have less than $2,000 in assets. For SSDI, they're looking at their 10-year work history. And they also look at their residency and citizenship status. Because it is a federal program, they need to be qualified immigrants or U.S. citizens. And the second thing is they look at the medical eligibility. Ultimately, what they're looking at is, does this person have a disability that's so severe that it'll prevent them from working a full-time job for 12 months? The eligibility criteria for CBEST is they need to reside in LA County because this is funded through Measure H. The services are for LA County residents, be low income, disability that prevents them from working, be a US citizen or qualified immigrant, and homeless or at risk of homelessness. For SSA, there needs to be a diagnosis of medical condition, either physical or mental health, evidence in the medical records illustrating functional impairment. And so it's really important that clients or applicants, they do have medical records that supports their disability allegation. And so if you're thinking of referring someone and you know that they haven't been seeing their provider, I would just encourage you to have them start seeing their doctor so that they can have medical records built up. And lastly, the impairments must be so severe that it prevents the individual from being able to work a full-time job for at least 12 months. This is the CBEST structure. CBEST is a multi-team, multi-step process. And as you can see, we have Housing for Health, the CARES team, which are DHS and DMH clinicians. We have our legal partners who assist with appeal services. We have our referral partners, such as community-based partners who submit the referrals, and the Social Security Administration, who ultimately makes a determination of whether the applicant will be awarded the benefit. This is our CBEST steps. And so the main thing that I'm going to highlight here is step one. When you submit a referral, it'll come to the outreach and referral team. Once it's received by the OAR team, it'll be assigned to a health program coordinator, and the health program coordinator will contact the client within 10 business days. Once the intake is completed, the consent forms are signed, all the vital documents are retrieved, it'll then go to step two. And so the process of applying for one of the benefits, it really varies and is case by case depending on the situation of the applicant. For example, an applicant may not have medical records. And so in step three, what we'll do is we'll put them on a CARES plan where they'll see a DHS clinician for 2 to 6 months to build up their medical records. But for someone who already has medical records, it'll just quickly go through the process without having to go through the CARES plan. So our collaborative partnership, your role as a referrer is to submit the CBEST referrals, supporting client engagement, and just spread the word and about our services to people experiencing homelessness. And if they're interested, you can go ahead and submit a referral on their behalf. Our role at CBEST is to support client in moving through the CBEST steps, keep you aware of progress on client cases, connect client to CBEST resources, file applications for federal disability benefits, and provide training and technical assistance to providers on CBEST services. This is the referral form. I'm not going to go through all of the detail. The top 2/3 of the form is the client information. It's just really basic information. And then the last third is the referrer's information, which would be your information. This takes less than 5 minutes to fill out. Once it's completed, you'll submit it to cbestreferral@dhs.lacounty.gov. And within 10 business days, a health program coordinator will reach out to the client for intake. So the value of CBEST, I think one of the things that I want to highlight is that there are many barriers for people experiencing homelessness to access benefits. For example, accessing their medical records. What we do at CBEST is we'll identify all of the medical facilities that they've visited in the past 2 years, and we will contact those medical facilities to retrieve their medical records. And not only will we retrieve it, but we'll view it, we'll assess it through the lens of SSA to determine whether or not we should move forward. In some cases, as I mentioned before, the disability allegation may be strong enough for us to move forward. However, the medical records will not be there. And so what we do as a service is we put them on the CARES plan to help them build up their medical records. And so from beginning to end, we really just come alongside the clients to ensure that their application is thorough and is strong, and will provide the best possible outcome. So one success story I'd like to share is this is Marcia. She was in recuperative care. She's 66 years old. She was in recuperative care back in 2018 because she was attacked on the streets. A referral was submitted to CBEST. One of our health program coordinators engaged with her. However, she was very reluctant to move forward because of, just she thought that some of the questions were too invasive. However, through time and through relationship building, we were able to just to gain her trust. And eventually she did complete the application and we submitted it. It was approved by SSA. However, when SSA tried contacting her to follow up and to get some documents signed, she wasn't able to be reached. And consequently, we had to close out the referral after a year of attempting to contact Marcia. Fortunately, about a year after that, Marcia, she was housed through one of DHS's interim housing sites. And during that time, another referral was submitted on her behalf, and we were able to quickly get the application submitted and approved on her behalf. And, in her own words, what she said was, it's wonderful to feel safe at night and to have a sense of peace inside. And so, the work that we do is to really help clients to gain not only increased income, but a sense of stability and peace. And I think Marcia's story just really highlights that. Next slide, please. Oh, we are on the next slide, sorry. So technical assistance and training. So this presentation is usually 30 to 45 minutes. I did it in less than 10 minutes. If you want to go deeper, I'm more than happy to do this presentation for your team. You can just reach out to me at this email listed here, and we can schedule a call. Thank you very much.
Thank you so much for your presentation, Stephen. I'd like to open it up to the group to see if you guys have any questions, including troubleshooting or just about the program description and how to access or refer. So let's open it up to the group. And also feel free to text in or chat in your questions as well throughout the training. I have Ms. Sampson. Please welcome. Go ahead and introduce your name, the agency that you work at, and if you could lead with the question. And thanks for being the first inquirer.
Okay. My name is Edith Sampson. I am with Testimonial Community Love Center. And my question is regarding a young lady that I've been working with in TLS housing. However, I believe she needs a deeper type of support than I'm able to provide her with. I believe she does have like a history of mental issues. She also, I believe, is difficult for her to maintain housing on her own and how she addresses situations. I believe she needs a different level of care than I'm able to provide for her, other than just housing. Because on my end, I'm TLS management, case manager. And for her, she needs something a lot deeper. And I'm just throwing it out there because I'm pulling at straws. What can I do to help her as far as referrals through to get to a deeper level of support that she needs?
Yeah, Miss Sampson, thank you so much for just sharing that. What you can, it sounds like she would be a strong referral for CBEST. And so after the call, Ashley will be sending out this information, as well as just the links to the referral form. Fill out the CBEST referral, and when you submit it to cbestreferral@dhs.lacounty.gov, make sure to CC me, syu4@dhs.lacounty.gov, and I'll make sure to assign it to one of my teammates. We also have DMH here, who is going to provide their scope of services, and I believe what they'll share will be relevant to the client that you're working with.
Thank you for that, Stephen. Edith, I think what might also be helpful is if you could text in your question, because when you say the client has deeper needs, if you could also elaborate on that, I think that'll be great. Well, I think what I'm hearing is that the client is in interim housing, but then they may need additional supportive services. So if you could text that in, I think that'll be great. And then also, as Steve recommended, I think the follow-ups would be helpful as well. With that, let's go to our, there was a hand that was raised, but Edith, I think that may have been you and you may have put it down. Are there any questions for, oh, still Edith. Are there any other questions for Stephen before we go to DMH?
And for the CAPI, what's
Oh,
the
Louis,
age requirement?
sorry.
I'm sorry, my name is Louis Bautista. I'm from St. Joseph Center. For the undocumented clients who we would like to refer to CBEST, what's the age limit for the CAPI? And do they have to have an ongoing mental health or medical condition, or is it just for age? Would their age just qualify them?
Yeah, cash assistance program for immigrants are for 18 and above. It does require applicants to either, or they would be qualified citizens. And so they need to have some sort of immigration status here, such as a green card. And in terms of the age cap, there is no age cap.
For CAPI?
For CAPI, yeah, the Cash Assistance Program for Immigrants.
So thank you for that question. And Nee, you also had a question. If you could please introduce your name and your agency. And then after this question, why don't we hop on over to DMH? Thank you.
Yeah, my name is Nee. I'm from Volunteer of America, Los Angeles. And I was just wondering, do you have like a rough estimate for the duration of the process from like the very start of the CBEST referral until the participant get works back that they get SSDI? Do you have an idea whether that would be like a year or a couple months? Thank you.
Yeah, it's really case by case. The faster ones are about a couple months. But for clients who don't have vital documents or don't have medical records, or may be here as a qualified immigrant but don't have evidence of it and are in the process of getting a new ID, those clients can take a lot longer, sometimes a year or even over a year, depending on how quickly they can build up their medical records, get their vital documents, or whatever it is they need. But if they have everything in place, then it can take anywhere between 2 to 3 months.
Thank you.
Thank you for that, Stephen. We're going to hold on DHS for now, and we're going to transition to DMH. Thank you. Please go ahead.
Hi, good morning, everyone. My name is Elizabeth Cope. I am a supervisor with the Department of Mental Health Home Team, which stands for Homeless Outreach Mobile Engagement. I will be speaking about my program within this presentation, but today I'm here to give you a overall idea of some of the programs that we have available to consumers of our interim housing sites. So first, I just want to start with giving a bit of a summary of the scope of our services under our interim housing contracts. So in all DMH programs, we are able to assist interim housing consumers with things like their CES triage tool, assist with acquiring documents such as, birth certificate ID, follow up on their status of housing application, link individuals to, obviously link them to mental health services, and also monitor to make sure that they are actively engaging in services, and refer to CBEST, which just presented, or any of the necessary supports. The degree in which, or I should say the intensity in which the consumer receives these services is going to depend on the type of mental health program that they're linked to. So in a bit, I will explain kind of that spectrum of care. I want to just provide some really concrete tools regarding some phone numbers, some support lines that can be given out to all consumers. DMH has a what we call our general helpline. And we used to call it our access line, but it's now the name is the DMH helpline. And within that line, there's a number of different options that are on the screen. So option 2 will provide a link to an emotional support line. Option 3, a line for veterans. There are other functions for that line, but these are 2 that I like to emphasize because they're great tools to provide to consumers should they need someone to talk to that are like non-crisis, like non-hospitalization or 911 calls, but just some warm support. And then I do also want to remind that the what used to be called the National Suicide Prevention Line is now our Suicide Crisis Lifeline, which can be accessed through 988. Also something to keep in your back pocket. Next slide. So here's where I just want to start kind of emphasizing that with our mental health system of care, we have different programs tailored to help individuals with different needs. So with mental health, there is a spectrum of need. There are individuals that need more support, and there's individuals that, just need a little support. So I'm going to start with the programs that provide more on the lower end. So outpatient services, these are clinic-based services. Here's an example on the screen of San Fernando Mental Health for those that work in the Valley. Rio Hondo Mental Health is another example that I heard some staff talk about linking clients there. So for this type of service, you would need to have a client who has a lower degree of functional impairment. They're able to keep an appointment. They're able to remember their appointments, take medication pretty independently or with some support. Next slide. So regardless of the level of care, again, I just want to go through the type of services that are offered through all specialty mental health programs, which is basically all of Department of Mental Health and Department of Mental Health contracted agencies. So what you see on the screen is just some of the services that we provide: outreach and engagement, assessment, medication, crisis intervention,
I'm sorry?
individual and group rehabilitation,
Yeah, so
intensive
now-
case management, and a whole
Using it.
slew of others. I think somebody's unmuted. Next slide. So as I said earlier, outpatient is more for your individuals who are a bit higher functioning, able to kind of manage some things on their own. Now I'm going to talk a little bit about full service partnership, or FSP for short. So this is a program that's really designed for individuals who need a lot more care. So to give you an idea of like the kind of the ratio of staff in a traditional outpatient program, a staff may have about 100 to 150 clients that they're providing services to. In the full service partnership program, ratio is usually 10-1 or 15-1. So the staff can provide a lot more attention to the individual, typically visiting once a week. So just to give you a quick rundown, the model, the FSP model is a whatever it takes. So whatever the client needs, we are going to try to tailor services to meet their needs. The services will include access to medication support, including psychiatry visits, nurse, therapy, intense case management, all field-based. So the team will be able to come to interim housing sites and provide services on site. And the FSP program also has a 24/7 crisis availability aspect to it. So if someone is in crisis in the evening or on a weekend or on a holiday, they will have a phone number where they can actually call their team and ask for help. And typically, the FSP program will also provide that information to the collateral, so that if, say, like an operator is observing that an FSP client is having like a really difficult evening, they also can call and say, I need some support for this consumer. Next slide. So kind of our next level of care, and really what I like to say, the highest level of care that exists outside of a hospital or a residential facility, is our home team. So that's the program that I work for, Homeless Outreach Mobile Engagement. So we serve adults, we serve individuals who are chronically homeless, living on the street, and really kind of, bordering on the need to be like in a hospital. Really struggling to access basic things like food, clothing, shelter. And so we typically call that grave disability. So with the home team, I just want to give a caveat in terms of like referrals. We mentioned the home team because there may be clients that are entering interim housing with a home team already working with them, because that really is our goal, is to try to get people inside. Typically, you are probably not going to be referring people to the home team that are already in interim housing, because they're not street homeless, and so they're already accepting services. So may not be appropriate for the home team. They might be more appropriate for an FSP program, for example. But again, because we are placing a lot of individuals in interim housing sites, we may already be involved and working and providing treatment to these consumers. Yeah, next slide, please. Some more tools to have, and just to also kind of provide a little bit of a distinction between the types of crises that might emerge. So in a situation where you have someone who is experiencing a very imminent or life-threatening situation, 911 would obviously be our go-to. But the what we call the access line or the helpline, as I said earlier, there are other options. There's actually an option for, if this is a psychiatric emergency, please press, and I can't remember the function, but it'll all be on the recording. But this would be more of a scenario where the individual is, perhaps more symptomatic, a bit more withdrawn, maybe hasn't been observed, coming out to get meals. And there is definitely a concern, but it is not like that imminent 911 situation. The access line is also a great, just general line to just get information regarding all things mental health. Next slide. So just to elaborate a bit more, so if there were a situation where it was an imminent, really needed kind of that urgent response, the recommendation is to call 911 and to really express that this is a psychiatric crisis, that the individual is maybe known to have a mental health condition, or is presenting with observations or behaviors that appear to be influenced by a mental health condition. And then, the hope is that if a mental evaluation unit is available, that is the type of team that would be dispatched to assess that psychiatric emergency. And some examples that would warrant a call to 911 would be someone who's maybe, experiencing some psychosis and running into traffic, or holding a weapon and making some threatening remarks to others or to themselves. So there's some examples. We also wanted to provide some resources for continued learning. Some time ago, UCLA and the Department of Mental Health entered a partnership and created this really great resource that we use. All of our field teams use this, and really all of Department of Mental Health, but it is also available to anyone. It's a public website. And some of the examples of the trainings that we frequently get asked for are de-escalation of anger-driven risk, or mental health crisis intervention, or just like mental health first aid. All of these are available either like recording, and you could just watch them whenever you have time, and some of them are live. So I really encourage individuals to take advantage of this site. It's a great resource. Next slide. Here are just some tools again to provide should you get stuck and you're not sure, like, what should I do in terms of, like, I have an issue with the psychiatric mobile response team, or you have a question about the home team. Also, if you need some help with troubleshooting, with linking people to outpatient clinic. So these are just some tools, some emails to individuals who oversee those respective programs, and hopefully we can help resolve any issues that come up. And again, when in doubt, please call our 24/7 access line. That's always a good starting point if you can't remember any of these others. Next slide. And one of many success stories. So this is Mr. Claudio. He was someone that a home team, I believe in Service Area 2, started working with. He had been homeless for 16 years. So that first picture is how they first met him. After a very long time, he finally accepted interim housing placement, a medication, and started to receive ongoing services. Ultimately, he moved into residential treatment, I believe a board and care, where he receives, basically 24/7 support and medication management, and just, a lot of supervision and support. And he has now been housed for 4 years. And I believe has been stepped down to an FSP program. So again, remembering that, like, spectrum of care, starting with like the highest need level of care, and then hopefully moving people through the system so that we can, kind of continue to have that movement and progress. Next slide. And I think that's it. Wow, I did that, I think, under 10. I'm not sure if I did. Any questions?
Liz, thank you so much. We're going to
Of course.
start with Jonna Kennedy. And again, you guys feel free to raise your hand and also text in all your questions, because we are developing a Q&A guide where we're going to address all the questions that were raised in all 3 trainings. So Jonna, why don't you kick us off? Thank you.
Hi, good morning. I am Janet Kennedy. I work with Volunteers of America. And I guess my question is as far as between outpatient services and FSP services, when we reach out to your department, would we identify, like, okay, I think they need outpatient services, or they're more of a higher need, they need FSP services, or is that something that your team will determine the level of service they need?
Yeah, so there isn't a specific team that would make that determination. We do try to provide as much guidance and presentations like this and some of our guides to give, a good sense of what an appropriate referral would look like. However, we do have what we call our mental health navigators, which are people who are there to help, like, the community decide, okay, it sounds like this case needs more of an FSP approach, or they meet that criteria for FSP. We are providing the list of service area navigators in the guide. I saw that at the beginning. But, Yeah, essentially, I hope I kind of described like the difference. Somebody who's fairly independent, able to follow up on appointments, able to remember that they have to answer their phone because their therapist is going to call them. Generally able to kind of maneuver, and the hope is that after a while with interim housing, you might be able to assess those things. That's someone who would be appropriate for an outpatient program. But someone who's not able to kind of manage things, they don't remember appointments, and their mental health is impairing them a bit more, and they're not able to access traditional services, then FSP would definitely be appropriate. And the navigator, when they get that FSP referral, they will still probably pick up the phone and call you and get more information and guide you on whether, oh, I think this might not be an appropriate referral. Let's try outpatient first.
Perfect. Thank you so much for your answer.
Sure. And I do see another question about FSP. How long does it take to hear back after submitting an FSP referral? Yeah, that's a good question. Really depends on the availability of slots in the specific area. I know the department is trying really hard to have, to expand our FSP programs and have more slots available. But the reality is that in some areas, some of the FSP programs are a bit more impacted. But the navigator should respond because they are the ones that receive all the referrals, and they'll look at the referrals, and they should respond and let you know your referral was received. At this time, we have a wait list so that you're aware. And what I always tell people is, if you can't get someone into an FSP right away, still put the referral in so that they're on the wait list, but perhaps still support them into an outpatient program just to kind of try to have some support online, if possible.
Thank you for that, everyone. And thank you, everyone, for texting your questions and also raising your hands. Thank you, Liz. I'm going to hand it over to our Public Health Department. Thank you.
Hi, good morning, everyone. My name is Leslie. I'm with LA County Department of Public Health, Substance Abuse Prevention and Control, also known as SAPC. So SAPC is the lead agency on substance use disorder treatment and manages all of the treatment and prevention services for substance use disorders. And there are several locations around LA County where these services can be accessed. And I'll go through the entryways in the next slide. So SAPC is client focused and wants to provide the services at the right time for the client. And so there are several ways to access the services. So you can use any of these to refer clients. The first one is the SASH line. It's the Substance Abuse Service Helpline. It's a 24/7 access line where you can call and someone will respond and do a screening or a referral to treatment to a provider that's available. And again, that's available at any time. So that's a good service, especially like during after hours. The other entryway is the core centers. So these are centers that are located throughout LA County where you can physically go in to speak with a substance use counselor, and they will do a screening and treatment referrals as necessary. The next resource is the SBAT. This is the Service and Bed Availability Tool. If you follow the link that's on the slide, you can go on, it's a directory, and you can filter it for the location, the type of service you're looking for that client, and then you can call that provider directly. So you can go on there, for example, to check, like you can put in a zip code, and then, for example, if you're looking for outpatient services, you can see where which outpatient services have availability within a 5-mile radius or a 10-mile radius. So that's a really good tool that's available for you, as well as Recover LA, which is the mobile-friendly app that is essentially the same thing as the SBAT. So that's a good thing to have on your phone. If you want to just go to recoverla.org, you can access the services there. And then the last thing I will mention is the CENS, the Client Engagement Navigation Services, which is the main entryway for the interim housing providers, and I'll go through that in a little bit more detail. Next slide. So the SEND service is face-to-face interaction that our SENS counselors, which are substance abuse counselors, go out to the sites, and they have established co-locations or can provide the services in person at several sites. They serve anyone who is either in the youth category, which is 12 to 17, young adults, or adults 21 and over. And all of their services comply with confidentiality requirements. Next slide. So the main activities for the core is outreach and engagement. They can assist with health program eligibility and enrollment. They provide education. So for example, they can provide workshops. Like if the client isn't ready to go to treatment, they can do like overdose prevention, recognizing an overdose and those types of client education so that the client is aware. They can do screening for treatment, and then they do those direct referrals to SUD treatment, appointment scheduling, follow-up, so they kind of like hold the hand of the client throughout to accessing treatment. And then they provide service navigation, referrals, and linkages to other services as well as needed, as well as agency and community education and tracking and reporting. Next slide. So the referral process is fairly easy. Anyone can refer. It could be you as the interim housing provider, a case manager, the client themselves can refer. So it could be anyone. You can refer when a client asks to be referred, or if you suspect that the client has SUD needs, that would trigger a referral. And the steps is just to complete the referral form, which we'll share with you, and it's on the guide. And you submit it to the corresponding area office, which I'll go through next. And then a representative will respond to your referral within 1 business day. Next slide. So again, this is just a visual for how the services happen. So anyone makes the referral, the SENS counselor then becomes the link to whatever the client needs, whether that's education, if the client needs a screening or needs to go to treatment, the SENS counselor becomes that linkage to treatment for that client. Next slide. So these are the area offices. So you're going to refer to the area office based on where the client is located. So we have contracted providers based on the service planning area. So depending on where the client is residing or where the client is, you would send in your referral or call the number at the corresponding area office listed on the slide. Next slide. An additional resource for you as IH providers is trainings that are provided by SAPC's Clinical Standards and Training Unit. You can go to the link, and there is a calendar where you can register for the trainings and see what trainings are coming up. They're really good trainings. I highly recommend for anyone who wants to learn more about SUDs and how to help your clients. So for example, like the ones on the screen are just some examples of the types of trainings that are offered. For example, trauma-informed care, approaches to working with individuals with SUD, etc. So we recommend that you take advantage of those. Next slide. And then I just wanted to share a success story. At one of the interim housing sites, we had an older male at one of the tiny home villages, and someone at the site had made a referral for the SENS counselor to come and see him and possibly do, an assessment and refer him to treatment. When the SENS counselor was there on site waiting to meet with the client, they realized that he was experiencing an overdose. And the SENS counselor had an overdose kit, which includes Narcan, and they were able to administer the Narcan and CPR and get the client stabilized. The client subsequently was referred to SUD services and therapy. And then also the SENS counselor provided education to all of the other residents by distributing overdose kits around the facility and educational material on what clients can do if they experience, if somebody else experiences an overdose, so that they can save that person's life. So that was a really good success story. You can go to the next slide. So here is my contact information, or Sandy Song, who's also the adult services manager. You can contact us if you have any questions or any concerns with SUD services. Next
Thank you
slide.
so much, Leslie.
Mhm.
And then
Yeah.
I was gonna, there
Mhm.
was some questions, but then I'm
Sure.
gonna hold. Please go ahead. You have a couple more slides. Go ahead. Thank you.
Okay. Yeah, I just wanted to share a few other things from the Department of Public Health that are not SAPC, but also available for your clients. So the Domestic Services Hotline is on the screen. So if you know of anyone that needs those services, please call that hotline. It's a 24/7 operated hotline. There's also tuberculosis and other communicable disease control resources available for you on the links provided. So please go ahead and use those as needed. Next slide. The other resource for you is the public health clinics. These are clinics that are located throughout LA County, and they include all kinds of services, including immunizations, screenings, and treatments for tuberculosis, sexual health services such as testing, diagnosis, and treatment. So you can go to the links provided and see where your nearest clinic is if your client needs any of those services, and you can have them make an appointment there to go. And that would be it. So I'll take the questions now.
Thank you so much. Louis, I think you had a question in regards to the overdose kit. So please go ahead. And the training does not provide CEUs, but that's something we'll definitely take into consideration. Go ahead, Louis, introduce yourself and your agency, and then Leslie will respond. And then we're going to Erica Shores. Oh, actually, no, Erica had to jump. So go ahead, Louis.
Hello. Hi, this is Louise again for St. Joseph Center. So from the website, the Wellbeing, the Wellbeing LA Learning Center, those don't provide CEUs. And then does the trainings at SAPC provide CEUs? And then my other question was, what does the overdose kit consist of? And are all these services available for people who are undocumented as well?
So as far as the CEUs, I believe there are certain CEUs that are offered. So if you go to that training link, the calendar, you can check on there which trainings offer CEUs. And because I think it depends on the training that you're taking. And then as far as the overdose kit, it consists of Narcan, educational material, and fentanyl test strips. Oh, did I answer all of your questions? I'm sorry.
And are all these services that the ones that you were saying for domestic violence, the clinics, are all these available to people who are undocumented as well?
Yes, the domestic violence and the clinics definitely, as well as the SAPC services, including like the SENS program. There may be some caveats when the client goes into treatment. They will get them, they may need like Medi-Cal. So I don't know the exact details for that, for the treatment component, but as far as like the linkages and the referrals, that and all the services that the SENS provides, that is definitely covered. But I will get back to you all on the treatment side for undocumented clients.
Do you provide any thing for like dental?
I don't know of any dental resources that are provided through the Department of Public Health other than education, which I can provide the link to that as well to Ashley after the training so that she can share with you all. But I
Thank you.
don't know if there are like dental service. I don't think that there are dental services provided through the Department of Public Health.
Louis, does the program client have dental insurance? Louis, that's a question for you. Oh,
I'm sorry, I didn't get that.
Does the client have dental insurance?
No, but I'm asking, I work with 2 undocumented clients and it's really hard to locate resources for them. So I know they got LA Healthcare and that covers for their medical.
Uh-huh.
But it's hard to connect them to dental resources.
Sure. I'm not sure.
Especially since they're engaging in substance use. So there's a lot of dental care that is needed there.
I'm not sure if any other departments or operators want to jump in to share their workaround solutions in serving undocumented program clients who have dental needs. So Louis texted USCE Dental offers free dental services, USC, for your clients. Louis, would you be able to text in like maybe a website or a contact information? Or if you could email us a brochure or whatever you have, and we'll be able to share out with the group, including Louis.
Thank you.
Thank you. All right. Now we're going to jump over to DPSS, and then we're going to jump into the real case scenarios. Go ahead. Thank you.
Good morning.
Hi, Lynette. Go ahead.
Good morning. My name is Lynette Franklin, and I am with the Homeless Services section. Go ahead, Martin.
Yes, my name is Martin. I work with Lynette at the Homeless Services section here at DPSS, and we are going to give a high-level overview of our programs and talk about Benefits Cal, renewals, customer service center, and requesting services. Next slide, please. So I imagine a lot of you are somewhat, if not very familiar with the services that we provide. CalFresh is one of them. CalFresh is assistance for buying food for low-income individuals. And here we have a breakdown of the basic eligibility requirements and the minimum requirements for application. But you know, there's so much information. Unfortunately, we won't delve into everything. And again, there'll be time for questions at the end. Next slide, please. We also offer here Medi-Cal for households and individuals. And Medi-Cal is also, it's a program that eligibility is based on income and household size. And again, there are charts and graphs that you can, look at to see those things. But then again, you can always just apply or call our customer service center, and we'll talk about that more later. Next slide, please. General Relief is a cash aid program for single adults who do not have dependents, single adults or couples. But if they do have dependents, our next program, next slide, please, is CalWorks, and that is the program for individuals or couples that have dependents. Okay, and then there again for all of our programs there are basic eligibility income requirements. Okay, next slide, please. Benefits Cal. Benefits Cal is a newer addition to DPSS that helps us statewide when it comes to assisting customers and organizations like yourselves in helping customers sign up for benefits and to see the status of their case. Benefits Cal is a great way for troubleshooting cases. I know a lot of times you may have a client whose GR or Medi-Cal or CalFresh benefits terminate and you're not sure why. Benefits Cal is a great resource. The customer can create an account And you could help them with that to create an account. They could see what's going on with any of their benefits, review any notices of action, and also they can submit through Benefits Cal anything that's being requested. So it's a great resource. And next slide, please. This is just some more information on Benefits Cal. Also, there is a YouTube channel on Benefits Cal. So anything you may need to do on Benefits Cal, if you're stuck or confused, you can go on the YouTube channel. There may even be a link somewhere on the Benefits Cal website, and it'll give you step-by-step instructions. Also, I will say that we also talked about troubleshooting, and we think that one good way to troubleshoot cases in addition to Benefits Cal is to, maybe you can keep a list. You can go on Benefits Cal. You can see whenever, because there are certain renewals that need to be done throughout the year. You can keep a listing of those renewals and the dates that they may be due, so that you can also have a heads up to avoid any possible disruption in benefits. And that's really all I wanted to talk about right now. I'll turn it over to my colleague, Lynette.
Thank you, Martin. So here we have the information for our customer service center. So our customer service center is another great tool to troubleshoot cases. So most of the time, the reason why a case terminated is due to a renewal or a missed periodic report. So through the customer service center, you can get information regarding the client's renewal date. You can also complete a renewal over the phone for CalFresh and Medi-Cal, and also for general relief. The customer service center can also assist you with a semi-annual report for CalFresh. And if for some reason it's not, the case did not terminate, or it's out of the time frame for the renewal, the customer service center can also assist with applying for benefits, reapplying for benefits. And the hour of operation for the customer service center is Monday through Friday from 7:30 a.m. to 6:30 p.m. Next slide, please. Okay, so for the programs listed here, we do have annual renewals. Again, Martin kind of touched on this, but we do encourage operators to maintain a document in the client's file that states when their renewal dates are. So the operator can monitor the renewal date and ensure that the appropriate steps are taken to complete that renewal. And again, renewals can be completed through Benefits Cal, through our renewal line, or at any local DPSS office. Next slide. Okay, so requesting services at the interim housing site. So when requesting services, the IH operator will work directly with DPSS to coordinate the services at the site. So you would send an email to the Mainstream Homeless Services at dpss.lacounty.gov with a current site roster of the clients that are enrolled at the site. So we will run that list through our system to see how many clients are receiving DPSS benefits. If there are 10 or more clients who are not receiving DPSS benefits, then we will set up on-site services for the clients to be able to apply for benefits, complete renewals, or and we do offer some other things. And if there are less than 10 clients who are not receiving benefits, then we will set up remote services. And so there will be a scheduled date where a dedicated hotline will be reserved for just the clients at your site to complete those services over the phone. So again, I just want to emphasize that we would need the current site roster to be emailed to the email address, and then we will vet the roster to determine what type of services will be provided at the site. Next slide, please. So the Mainstream Homeless Services email can also be used if you have any questions on a DPSS program or you need some troubleshooting or some assistance. That email can be used. If for some reason you are experiencing any issues with referral pathways or accessing on-site or remote services, you can email me directly. And my email address is LynetteFranklin@dpss.lacounty.gov, or you can email my managers, which are Marjorie Aurora at dpss.lacounty.gov, or Lisa Hayes at dpss.lacounty.gov. Next slide. So now I just wanted to go over a successful partnership that we did have with the site. So I received an email from a program coordinator who was requesting mainstream services at the site. So they sent over the current site roster, which we cleared. Through that clearing, we determined that on-site services were needed. So the program manager and myself coordinated the initial site visit. And then within 5 days of that initial site visit, we had our team go out to provide services on site. So, and before the team arrived, the program manager created a schedule for the clients that would see our eligibility workers on that day. And through that partnership, we were able to collect 10 applications, provide 3 EBT cards, 1 DMV ID voucher, 5 verification of benefits, and 14 general case inquiries for clients to retain their benefits. And then after the visit, I did follow up with the site to provide any additional assistance that the site needed. So we just want to emphasize that mainstream services is the most successful when we have coordination with the program managers and their assistants. Is the most successful partnership. And then we're going to go to the next slide. And so far, we have provided services at 76 interim housing sites, which resulted in 268 applications, 105 EBT cards, 34 Medi-Cal cards, 78 verification of benefits, and 403 general inquiries on existing cases for clients to retain benefits. And now we will go to if anyone has any questions.
Thank you so much, Lynette. We actually do have a couple questions for you. Edith
Okay.
has texted you asking you to contact her because she has some questions about clients who were not able to renew or redetermine their SSI benefits. Jana, please go ahead and ask your question. You had a question on the client roster.
I did, thank you. So Lynette, you partially answered my question already. But you had stated that you and the program manager would do an initial walkthrough, and possibly within 5 days your team can come out once it's determined that you can do on-site services. But the other half of my question, I guess, would be, once we submit the roster and you are able to come out, how soon does the initial walkthrough take place?
So normally, once we receive the roster, it takes about 3 to 5 days for us to clear it, and then it just depends on the schedule for the site. If you have availability, normally it's within 1 to 2 weeks that we would go to the site to provide the services.
Okay, perfect. Thank you so
from the
much.
initial email.
Awesome. Thank you so much.
Okay, you're welcome.
Thank you so much for that question. Edith, I'm not sure if you want to take a moment to ask your question about the redetermination, or do you rather check in with Lynette offline? All right, we'll check in offline. Next slide. Thank you so much, Lynette.
You're
and
welcome.
Carlos.
I'm sorry, I didn't realize I was muted. Could I ask my question still?
Of course, please go ahead.
So I have a couple of young ladies that are trying to get their SSI benefits reestablished, and they have no direction. And being is that I'm kind of new to the game, I don't really have any direction for them either. So if I could get some direction in helping them get their benefits reestablished, that would be so wonderful.
Okay, for the SSI benefits, that actually may be Steven's department.
Okay.
Yeah, to reestablish SSI benefits.
Okay.
I did just want to verify you're not, do you mean DPSS like GR, CalFresh, Medi-Cal, any of those benefits, or are you really referring to SSI benefits that need
I
to be
am really
reestablished?
referring to SSI benefits. One of my young ladies she's in Palmdale, and I don't know how, again, I'm just kind of new to the whole situation, and I'm trying to find direction on how she can actually get herself back involved or get her benefits back on course. I have a couple young ladies like that.
Hi,
Get
this is
back on
Steve with
SSI.
CBEST.
I'm sorry.
This is Steve with CBEST.
Yes,
Do you
Steve.
know why the benefits was terminated?
I think what it was is that because they're homeless, they're not getting mail and they're not getting themselves to appointments or what have you. So that's what's going on with that.
Yep. So just submit a referral and CC me to the email. And this for people who have formerly received benefits, the process is usually faster.
Okay.
So, yeah, just submit a referral, CC me to the email, and then
Is there any specific information that they would require along with that referral?
Yeah, if you have like the benefit document, such as like the award letter from SSA as well as the termination letter, that'll be helpful. If not, that's completely fine. But just make sure to mention on the referral form and the email that this client was formerly receiving benefits. And there's a section in the referral form where it asks you that question.
Okay, very good. Thank you, Stephen.
Yeah, of course.
Wonderful. Thank you so much, you guys. And again, we really encourage you guys to chat in your questions or raise your hand. Next slide. And thank you for all the departments. We appreciate your presentation. We want to take a moment to ask you a quick question on the utility of the guide. Next slide. We are looking at some future enhancements where we're going to move some documents around so that the cheat sheet will be at the front of the manual instead of being part of the attachments. And we're also looking at developing a shorter version of the guide, which could be a companion, as well as looking at some potential flowcharts showing the referral process, and also considering adding a section on Department of Children and Family Services. So we want to ask you a question to our next slide. If you guys could provide some, initial reaction, and I know that some of you guys actually have to flip through the guide, as the end users, because this guide is only useful if it's easy for you guys to use it, right? Do you feel that you have an adequate understanding of the mainstream services? And if you think the guide is easy to follow, and if you think there is any information missing, including like information on DCFS or anything else, we just wanted to open it up to the group really briefly, knowing that you'll have an opportunity to provide that via post-training survey. So let's open up to the group for a couple of minutes if anyone wants to speak to these questions. Any general response in terms of was the information that was provided to you, was it easy to follow? And do you feel that you have an improved understanding of mainstream programs? And feel free to give us thumbs up, click a reaction thumbs up. Edith, go ahead.
Yes, I just want to say I'm just truly grateful for all of these resources. And it just have shed light on a lot of different questions that I do have as I'm learning my clients. I believe that this information is going to be most beneficial. I can't even explain to you how overjoyed I am for this particular training because it put all different dynamics together for me. Different ones that you can see the collaboration and the connection between entities. And that's what I've been missing dealing with my clients for the duration of the time that I've been at this particular company. My main focus has been housing, but housing separate from all the other things all the other dynamics that the client is either going through, whether it's mental health, whether it's domestic violence, all of these different things that are part of this person's life. also need to be dealt with. We need to be able to deal with the whole person. So I'm looking at all of these different entities that you're bringing together, and mainstreaming is pretty much like you said, bringing everyone together to deal with one person, because everybody that I've heard speak here, it taps into what my clients are going through and what I'm going through with my clients, and the frustration they're dealing with without, it's like knowing it's out there and can't touch it. So I just want to say thanks for that. This is awesome.
We appreciate that. And we really do hope that people take an opportunity to even look at the guide, because this 10-minute presentation by the department, we can't capture everything. So the department sections aren't that long, you guys. So do definitely take a look at the guide, because it's going to definitely provide additional tips as well. So thank you so much for that. And Jana, thank you so much for your comment on, your feedback about, being these programs being very explained well and clearly. So let's go to the next slide. So now we're going to apply the guide, and we had an opportunity to interview numerous interim housing operators, and we tried to highlight a client story. So this is a moment where we get to hear from each other, and then we also are able to learn from other interim housing operators who may have had the same challenge for their clients, and then they actually had a good solution that worked. We want you guys to just share that out and bless everyone with that. And then also departments to jump in as well to be able to connect the dots. And then also, I think we have to look at what are our training needs. And also, if we identify service gaps, then what are some new actions that we have to take together? So with that, I'm going to hand it over to our first speaker to describe the scenario. And welcome, Team Jovenes. Go ahead. Natalie, who's our speaker from Jovenes?
I'm not seeing them on the call.
Got it. If you don't mind, if you could email them, and then, but why don't we go to our second scenario? Thank you for multitasking, Natalie. All right, we're gonna now hand it over to Team the Salvation Army. Go ahead.
I'm not seeing them on the call either. They might have had to jump off.
Well, let's go to scenario 3, and then Homeless Initiative will cover the first 2 scenarios. So do we have Team the Whole Child on board?
Yes, I'm here.
Awesome, thank you.
So my name is Sarah. I work at Safe Families Interim Housing with the Whole Child in Echo Park. A scenario that I had brought up was us having a 33-year-old single mom who's battling like depression, anxiety, undiagnosed PTSD, and on and off substance use. The goal of our housing program is obviously for the family to figure out how to increase their income to get housed. But when you have other barriers, of course, we want to link them to outside providers. So one of the barriers that we had with this family outside of the mental health, which we did send a referral out, I believe, to Pacific Clinics, is that like as a case manager, I might have a caseload of 30 families or so, and not getting a response back on whether or not they've been connected to the whether or not they've been reached out to. So it would be myself then following up, asking whoever I sent the referral to, like, were you able to reach out to the client? Because sometimes she wouldn't be completely honest with me and letting me know whether or not they reached out to her or if her phone was working or not. Unlike, let's say, compared to CBEST, because when I referred a different family to CBEST, I got a response within 2 weeks, whether or not they were connected to the resource. Another challenge we have is the lack of childcare in this area because everything is waitlisted. I didn't see on the guide, but someone we utilize a lot is LACO. So our LACO person is able to reach out, enroll our families in the nearby schools, but he also asks if they can go into their after school program, and that has helped a lot with childcare services.
Thank you so much for sharing that. So I think the time is now in terms of, in regards to challenges, if any departments and operators could jump in as a collective brain trust to share any recommendations. Or you could also like weigh in and say, you know what, I experienced the same situation and this is where I need help. And you could add to the challenge as well. So feel free to raise your hand and then we would love to get your insight. Martin, please, thank you.
Hi, I'm sorry, I missed your name. Can you repeat your name?
My name's Sarah.
Hi, Sarah. So, does this client currently have a case with us? Does she have CalWORKs case?
Yes.
Okay. I know that there are services for if she were to talk to her case manager. There are services for childcare, and I know that when someone may be having an addiction issue, that may get in the way sometimes because there are certain requirements, and I know that when someone has an addiction, it may be hard for them to keep up with some of those requirements. But I do know that there are some childcare services for people who are enrolled, and I suggest that she do speak with her case manager.
Okay.
Thank you, Martin. Does anyone else have any comments in regards to mental health and SUD resources? What they're also asking is that they want to be provided with updates on whether the client was connected or not to services after the referrals have been made.
Yeah, I will say in terms of mental health, I hear you with a little bit of frustration and not getting updates and share that with you. I think it sounds like you did a great job in reaching out to the referring party. And I do think the reality is that sometimes that is going to need to happen as you following up. But I will communicate, which we continually do, communicate to our navigators the importance of at least letting the referring party know your referral is received. This is who it was assigned to. But I do encourage that if you're not sure, I know I keep advertising those navigators, but they really do hold the information for anything that's like an FSP referral. So definitely don't be shy, call them, email them, and let them know that you need an update. And the hope is that once they see that you're a very proactive referring party, the communication will continue to flow.
Thank you.
Liz, I don't want to put you on the spot, but then will you be able to speak to if there are different trainings targeting different populations? And I may also need to ask LAHSA to weigh in since there is robust menu of training topics in their centralized training academy. But Liz, we would love to get your insight.
Yeah. So we did talk about our UCLA well-being website at the beginning that offers kind of like these ready-made trainings on various topics. But if your organization does not see a training on there that meets the needs that you have at the moment, I did share this yesterday, and I will again. The Department of Mental Health has a speakers bureau, which is basically basically subject matter experts that are part of like a menu of trainings that can be provided. And we do try to customize if possible to meet the needs of the organization. So I'll put the link in the chat of the Speakers Bureau because a request can be made through their link on any mental health related trainings that you can't find on some of our pre-established training sites.
Thank you, Liz.
Absolutely.
I did have a follow-up question in regards to like transportation. So I know that the families live in SPA 4, but then the services are in SPA 7, and families do not have mode of transportation. Sarah, can I ask you a question? Are there services in SPA 4 where it's close to where they live, or is it because we're trying to maintain that existing relationship, which takes time to build?
Mm, yes, we're trying to maintain the relationship, but also I think we're trying to stay within the boundaries of the spa. So if our families are from spa 7, but our shelter's in spa 4, we're trying to continue with the services in spa 7, but the barrier would be transportation getting back out there.
Got it. And obviously, we don't want kids changing schools for services. And at the same time, we're also trying to maintain the same rapport and relationship with the providers. Um, I- are there transportation vouchers that we could provide to families? Because I know that taking the bus, it could take good 2 hours, right?
Hi, this is Martin, DPSS again. And also with CalWorks programs for clients who are successfully, engaged, there is transportation assistance.
Okay. So I think that's one solution, and I think it's definitely worth looking into other options as well. But Martin, thank you so much. Um, so I think we're ready for the second scenario, and I'm going to hand it over to Team the Salvation Army. Thank you so much for joining, and thank you, Sarah. Jesse, go ahead.
Jessie, she's on and she's unmuted, but we can't hear you, Jessie, if you're speaking.
So while Jessie troubleshoots, let's go to scenario 1. So Jessie said that she's not muted. Jessie, we weren't able to hear you, but we're going to do scenario 1, and then we're going to tee you up for the last one. So just wanted to make sure, do we have Hovhannes with us? Okay. All right, you guys. So I'm their backup. So I'm going to move forward. All right. So Hovhannes shared with us that, and this was coming from the lead case manager at the new Ava's home in Spa 7. She had a client, a Hispanic female, young, 24 years old. And the client presented some mental health illnesses, including mood swings, where she goes off on tangents, and she definitely reflects trauma in her speech. She also had some physical challenges, including stumbling, and also she wasn't as functional. She also had some substance abuse challenges, including drug use actually at the interim housing, which caused potential harm for themselves and for others. At the intake, the client became hostile, and the staff requested that they stay in their room for the night to be able to avoid altercations with other clients. And the staff created an incident report and met with the client next day to avoid the same behavior continuing. The case manager makes referrals as appropriate and assists with benefit appointments and applications. The challenge is that they want more staff training so that they could better de-escalate or address hostile situations. Because we also know that, you guys, this doesn't sometimes it gradually, builds up, and sometimes it just literally explodes, and you guys been there. And I think the second thing what the challenge was, they want to be able to have quicker access to substance abuse resources. What she shared is that sometimes it could take a month to be able to access SAPC's beds. And also what she wanted was a list of agencies that are currently taking new intakes or beds, like the DMH provider agencies. So those were the challenges that they had shared. I'd like to open it up to the group and see if anyone else wants to say, I have the same problem, well, what about this? And these are the solutions and connections. Let me open up to the group, and feel free to raise your hand. And you're going to see a lot of similar themes coming from our operators as well. Liz, I think you're jumping in. Thanks so much.
Yeah, I'll jump in. So as I mentioned, we have our UCLA partnership website. And then I did post the information regarding the LA County Department of Mental Health Speakers Bureau. But I did, prior to this look, there is a specific training on the UCLA partnership website regarding de-escalating hostile situations. I think it has a little bit of a different title, but definitely a related subject. Also regarding an agency accepting new intakes. So you're in SPA 7, right? So our outpatient programs, they always take new clients. Like DMH outpatient programs never stop taking new clients. Sometimes contractors may not be able to take clients, and then they'll direct people to DMH directly operated clinics. So you shouldn't have an issue with getting an appointment. FSP programs, on the other hand, as I mentioned earlier, definitely submit the referral, and the navigator should be able to let you know if there's a little bit of a wait. I will mention that one of the things that we are communicating to our all of our providers, all of our mental health providers, is because of the state of emergency on homelessness, they are expected to provide services to people experiencing homelessness at a like I should say, they're supposed to provide priority for that population. So the hope is that, that is being noticed, but that is the messaging that is being distributed to all of our system of care.
Thank you for that, Liz.
Can I chime in? This is Leslie.
Yes, please.
Okay. So I just wanted to say, I don't know which substance or how you're trying to refer to SAPC programs, but like you may want to reach out to different, like if you're only reaching out to one provider and they don't have a bed, there may be others available. So you can use tools like the SBAT tool, or you can call the SASH line, but also I really want to emphasize the sense counselors as well, because they can help you with that, like service navigation, and help to find like where there's treatment available, and help like to connect that client to a bed. Because I know some services may be impacted at certain locations, but I think they can really try to help with like finding where there is a bed available for that client.
Thank you for that. As it relates to this case, are there any other challenges that other operators experience that's related to this case? Or do you guys have any recommended solutions that you guys employed and that were helpful to you? We have a pretty quiet group, you guys. All right. Well, Jesse, we're going to tee you up. Go ahead. Thanks for joining. Hopefully we could hear you. Go ahead.
Hi, hello. Can you guys hear me?
You're right on. Perfect. Thanks.
Awesome. Okay. So my the client here they're presenting is African American, 32 years old. A lot of critical conditions. Also didn't come in with a Medi-Cal or any service provider. No income. Different mental health barriers. Schizophrenia, bipolar, PTSD. Erratic mood swings, especially sometimes there would be a lot of incidents in the bed areas where maybe other clients are reporting this individual. Didn't show up for case management. It was very difficult to engage the participant, and when doing so, would become combative with case managers. Did have history of substance use with meth, and sometimes would go AWOL, so would not sleep in his bed more than maybe 2 or 3 nights. Didn't have any job history, no income. Once the client was at the shelter, the main focus was trying to connect the individual with GR. Did have a learning disability, poor hygiene, and this was seen most when bed checks were completed. You'd find urine or buckets of urine or water bottles filled with urine around the bed area. Had a DCFS case open, and wanted to reunite with the teenage daughter, but there's a lot of behavioral health condition barriers. On site, was connected with a clinician. We do have somebody who, while participants are waiting to get connected to a mental health clinic, can see a therapist on site. We try to make that very brief. So once clients are connected and hopefully also housed, won't depend on the service at the shelter, but can actually have a clinic to follow them to wherever they're going to be going. Some of the places where we do send individuals is Penny Lane, Rio Hondo, Inky, DMH, like a actual DMH direct referral, and or Recovery Bridge housing. So yeah, most of the challenges were with the individual's mental illness and trying to connect to the appropriate services and still have the participant engage in this case. Some of the other challenges are once these requests or for services are made, it does take some time to actually receive a response. And then usually once, if, for example, they try calling the participant once, and they miss that opportunity to, complete intake, then it takes more time to have to reschedule that appointment, just so the individual can get connected, service connected. Yeah.
Jessie, thank you so much for sharing that story. Now I'd like to open up to the group again. This is our last scenario, you guys. So let's do an all hands on deck teamwork here. So feel free to raise your hand and jump in.
Liz, jump in.
Always the champion. You go, Liz.
I'll just jump in. So, this is a really great example. I know earlier I mentioned that you were rarely referred to the home team if someone's already in one of your facilities. It doesn't mean that we are not appropriate. It just means that we will likely be, less appropriate if someone's already housed and accepting services. But, good example of someone who is probably going to lose their interim housing placement if they don't get some support from a higher intensity program. So good call on the home referral. In terms of your comment about, home arriving, I think like maybe without some notice. I always like to tell the referring party, because the way we accept referrals is via email. You're probably familiar with that because you submitted. In that body of the email, you can very specifically say, please contact referring party prior to visiting so that we can secure that warm handoff. We try to do that all the time, but I know we're in and out of Salvation Army quite a bit. My team is there all the time. So there might have just been like well, we're already here. We're going to try to meet the client. But if you specify that in the referral, we will definitely respect that and reach out to the referring party so that we can kind of, follow your lead. And then also, the hope is that the home team is able to assess whether this individual maybe needs more support and needs to be moved on to like a board and care or some other type of residential housing. But I'll just say, I'll plug that I really appreciate how our interim housing providers will work with our clients, because, sometimes this is like the only way to get them indoor. And sometimes we very well know that they might struggle, and we're just trying to get them inside and move them into a more appropriate setting. But when someone is willing to come inside, we are really going to try to find kind of the quickest solution, and try to provide a lot of support so that they can, maintain some level of stability until we get them into the best place, the end point. So I just want to say thank you for working with such challenging consumers.
I think that's,
Here you are.
Elizabeth, were you jumping in with a question? Okay. Anyone else wants to jump in? Or any insight, recommendations? Leslie, I'm not sure if you had any feedback in regards to more training and non-compliance.
Nothing additional to what I've recommended for the other ones. Like, I think this is another case where like the sense counselor would be appropriate to try to get that client into services if they're open to it. So, I think I would start with that, like making a referral to the SENS, and they would kind of guide them through the process and see where they're at and see if they'd be willing to go to treatment if they need it, So that's what I would do.
Okay. Jesse, did you have any other questions? This is a perfect opportunity. You have them all. You have your colleagues who's going through this as well as departments.
For the moment, no.
Okay. Before we transition, any other questions from other operators on this case or similar case? All right. Well, let's go to the next slide. So you guys, we are looking at continuing to strengthen our interagency coordination. Next slide. And as for our next steps, we're looking at sending out a post-training evaluation survey, which is going to ask questions in terms of what you guys gained from this training, and also how we could improve our future efforts to strengthen partnerships and how we could better support each other. And we will be having quarterly sessions. I saw a question in terms of when's our next one. So we're going to be having another one in late July. And we'll be sending out survey in terms of what your future training topics should be. We will be establishing a training committee consisting of the departments, some interim housing funders, as well as some subject matter experts from our provider group. So that we're going to be discussing, again, the training topics, the training clusters, whether it should be a general session like this, or whether it should be spa-based or population-based, as well as training venues, if we're going to slowly go back to meeting in person or if we continue to do it virtually. So what I want to ask you guys is, do any of these resonate with you guys in terms of like what future training topics would be, as well as what is your recommended mode of meetings? Whether it should be in person, virtual, and also if we should be meeting separately with spa-based or population-based partners. So your early feedback would be great right now if you have any at this time, but the survey will be asking this question too.
Hello. Hi.
Go ahead. Thank you, Lisa.
Hi. I believe that I understand with COVID and everything that this virtual is, I think it's the most, it's the most convenient. We're so hit with clients and sessions and the amount of time. And so this is the most flexible. And also if I can't take it, the call in my office, if I'm out in the field, I can stop, park, and I can at least, participate, listen, be a part of. I can't even imagine right now, honestly, getting in the car with all the meetings that we have and all the updates with everything with CHAMP and HMIS and everything else. I can't imagine having to drive somewhere else and deal with that. So I think that would be the most important. And I think the spa-based is probably, I feel the best because we deal with different things in each spa. We have different circumstances, different resources, different protocols, procedures, depending on the spa itself. So and also the sessions probably, or the meetings would probably run much longer because you're dealing with so many different spas. So that's a no-brainer as far as I'm concerned. I think it should be broken up in spas, and I think virtual is the way to go. And that's my 2 cents.
Thank you so much, Lisa. Thanks for jumping in.
Sure.
Anyone else, based on what Lisa shared, as well as some future training topics, you guys? Because we understand that every minute of the training needs to count, because we know that you guys are putting out many fires. Okay. You guys will definitely send out a survey, so please do provide your feedback. With that, let me open it up to the group one last time. If you guys have any questions to departments, there's no reason for us to end the meeting at 11. We could always end earlier. So one last question to see if our operators had any questions to our departments or to each other. I don't know, you guys. It's hard to read your faces, you guys. Maybe you guys sort of need to stew a bit and then let us know. All right. So before we break, what would be helpful is if you guys have like one word that comes to mind, if we could stop screen sharing, how you feel as a result of this training moving forward. That'll be great. One word, and feel free to shout it out, and then we will break, you guys.
I feel informed.
There you go.
So Edith, informed. Go ahead, Elizabeth. Oh, I thought someone was piping in. Maybe it wasn't you. Anyone else? Go ahead, you guys. Jump in. One word, how you feel.
Educated.
Educated, right on. Thankful, safe. Connected, enlightened. Not alone, absolutely, and ready. So you guys, and aware, you guys, thank you so much. I think all those words that you guys shared, it definitely speaks to what we're trying to achieve. And I think at the end of the day, we know that this is hard work. So it's one challenge for the clients, but it's also another challenge, and just the level of commitment and tenacity, what our homeless operators really have to demonstrate and sustain each and every day. So we just want to say thank you for your partnership. Thank you for that everything we do. We look forward to reconnecting with you via post surveys as well as to future meetings, and also developing a question and answer guide that summarizes our response to your questions. And you guys will get a copy of the presentation slides. It's going to have an email address. So if there's any other, light bulbs that might go on in terms of recommendations or any challenging questions that you need to have addressed, please do email us. With that, you guys, thank you to the presenters and thank you to all the partners, and we'll be in touch soon. Have a great day. Bye-bye.